Turning first to the COVID-19 situation in this province and yet another obstacle in the effort to get vaccines to Ontarians.
Premier Doug Ford voicing his anger as the government's rollout strategy shifts once again. CTV's Queen's Park Bureau Chief Colin DeMello is live with more. Colin.
And the Premier, Michelle, revealed today that as a result of the national vaccine shortage, Ontario is not going to be able to meet its self-imposed deadline of having every long-term care resident receive their first dose of the vaccine by Feb 5th. It's another challenging week for Ontario's COVID-19 vaccination rollout. After receiving 0 shipments of the Pfizer vaccine last week, the province is still facing a shortage this week. Roughly 90,000 doses of both the Pfizer and Moderna vaccines are expected to arrive this week, far from the 223,000 Ontario had expected, leaving the province in a disappointed daze.
And all of a sudden it changes once, and then it changes again, and then it changes again.
The province is once again tweaking its distribution plan. Instead of vaccinating all long-term care residents by the 5th of February, the province will now complete that task by February 10th. And the province can no longer provide a firm date for when the second phase of its strategy will actually begin.
And we're not there yet simply because we don't have the vaccines. But that priority will start with 80-plus-year-olds, 75-plus-year-olds, 70-year-olds, and we'll move down each bracket.
While the Premier is expressing his frustration with the federal government over the delays, the province is also facing questions over its own distribution strategy. Ontario received the Pfizer vaccine on December 14th and decided to prioritize long-term care employees. Meanwhile, between mid-December and today, more than 1,100 long-term care residents have lost their lives to the pandemic.
People in long-term care, the most vulnerable to dying from COVID-19, didn't get their vaccines. Some still haven't got their vaccines. Those people should have been absolutely first.
The Premier says the government's hands were tied.
Pfizer gave us instructions that we couldn't move the vaccine.
But other countries such as Israel decided to repackage the vials and move them anyway, completing all nursing home vaccinations in early January. Hillier insists Ontario asked for permission back in December.
We did not have permission to move the vaccine until, in fact, we started doing the protocols in early January to give us the protocols to be able to actually move it.
Now, nearly a month after getting the green light, the province is still trying to inoculate those most at risk. And Premier Doug Ford also said today, in retrospect, the government made the right decision in reserving doses of the vaccine. And he says until additional vials are going to be made available, the province's focus right now is on long-term care and ensuring second doses are administered. Reporting live at Queen's Park, I'm Colin DeMello. Michelle, over to you.
Thank you, Colin.